My name is Heather Clark. I'm a resident of Scituate and a lifelong resident of Massachusetts. I support the Medicare for All bills, H 1267, S 766, not only because I believe healthcare is a human right, but because our current system of healthcare financing is financially devastating to working people and unsustainable for the taxpayers of the Commonwealth. I want to share my story because almost every resident in Massachusetts will face it one day: caring for aging parents. In 2014, our family was faced with a crisis. My mother's COPD had advanced. She was now fully oxygen dependent and could no longer care for my father, who had dementia and mobility issues. I made the decision to leave my job to care for them in their home while also caring for my two school-aged children. My family would need to live on a single income, but we could manage. My sister provided additional care, which for her added up to 2 full-time jobs. It was hard, but we felt fortunate to be able to keep our parents in their home. After a lifetime of hard work, my parents owned their own home and had saved for retirement. This should have been enough, but it was not. Despite Medicare and Medicaid supplement, they incurred thousands of dollars in uncovered medical expenses each year. By 2018 and 2019, these expenses topped $12,000 per year, 1/3 of their income. Shockingly, they even had to pay copays for my mother's oxygen. These costs might have been even higher, but my father, a Korean War veteran, qualified for VA health services, which saved thousands. For the last 2 years of their lives, they required full-time care, so we hired a caregiver for 40 hours per week. This was in addition to, not instead of, the care we provided. Our last year with my parents was haunted by the unrelenting stress of watching them struggle while wondering how we were going to afford to keep them in their home. The financial cost over those last 5 years, including uncovered medical costs and my lost wages, totaled in the hundreds of thousands. Most families can't afford to do this, no matter how much they want to care for their loved ones at home. In February 2019, my father, Howard Clark, died at home at the age of 86. My mother, Judith Clark, died in October of that same year at home at age 83. I think of them every day. I love them, and I'm proud that we were able to let them live out their lives at home. But there is one regret I have, and I know it is shared by virtually everyone in this situation. It's when you begin to hope that your parents die before the money runs out. It's a terrible feeling that no one should have to bear. We know that single-payer public health insurance, Medicare for All, saves lives, improves healthcare access and outcomes, and saves money for the vast majority of working families. It also saves money for the state. Medicare for All would protect hardworking, good people from financial devastation. It will spare us from ever hoping that our beloved parents die before the money runs out. I urge the committee to vote in support of H 1267, S 766, an act establishing Medicare for All in Massachusetts. If I may, I noticed that both chairs had questions about Medicare and about the Vermont situation. Would it be permissible for me to attempt to answer a couple of those questions?
Sure.
Okay. To Chair Cindy Friedman, you mentioned some of the shortcomings of Medicare. I think it's important to iterate that Medicare for All is not Medicare and not subject to the same kinds of coverage restrictions that current Medicare is. Medicare for All would cover all medically necessitated treatment and services. The doctors fight much less for coverage through Medicare than any other private insurance. Medicare supports evidence-based treatment, not treatment based on profits. So occasionally Medicare may disagree with a drug prescription, but I know from experience that if a prescribed drug under Medicare does not work or causes side effects, they do consider other treatments, many of them more expensive. Finally, Medicare has an appeals process, and in fact, a judge presides over these appeals. I know because I made an appeal on behalf of my parents. Under current Medicare, there's the 20% coinsurance for hospitalization, which is enormous and unaffordable. Current Medicare does not cover dental, hearing, or vision services. Medicare for All would cover it. So I think that many people, when they hear Medicare for All, they assume we're talking about Medicare, current Medicare, with its limitations and simply expanding it. And that is not what this bill does. For Chair John Long, you posed the questions about Vermont. There are two key reasons. I mean, obviously there are several why the Medicare for All bills in Vermont failed. One of the exemptions that was made exempted corporations that are based out of state from the payroll tax. So, as you know, there were very few corporations in Vermont, and very few of them are headquartered in Vermont. So that the anticipated income took a huge hit there. Also, the Vermont population is about 600,000. Massachusetts is about 6 million plus. So we are 10 times the size and would certainly be in a better negotiating position. We have a bigger, broader, richer business environment here. And so I think that our situation would look much, much different. Thank you all for allowing me to testify.